The way medicine works in the body is a complex and fascinating process that can be broken down into two main concepts: pharmacokinetics and pharmacodynamics. Pharmacokinetics describes the journey of a drug through the body from the moment it's taken until it's completely eliminated. It's often summarized by the acronym ADME, absorption. This is the process of the medicine entering the bloodstream from its site of administration. For a pill, this happens in the stomach and small intestine. The amount of medicine that gets absorbed and enters the bloodstream is called its bioavailability. Distribution. Once in the bloodstream, the drug is distributed throughout the body to various tissues and organs. The blood-brain barrier is a good example of how some areas are harder for drugs to reach than others. Metabolism. The body sees most medicines as foreign substances and tries to break them down. This process, primarily carried out by enzymes in the liver, changes the drug's chemical structure, often making it inactive and easier to excrete. Elimination. Excretion. The final step is the removal of the drug and its metabolites from the body, usually through the kidneys, in urine, or the intestines, in stool. Pharmacodynamics. What the drug does to the body. Pharmacodynamics is the study of how a drug produces its effect on the body. This is where the actual work of the medicine happens, and it's mainly about the interaction between the drug and its molecular targets, which are typically proteins like receptors or enzymes. Think of it like a lock and key. Receptors. Many drugs work by binding to specific receptors on a cell's surface or inside a cell. These receptors are like locks that are normally unlocked by the body's natural molecules, like hormones or neurotransmitters. Agonists. These drugs are like a duplicate key. They mimic the shape of the body's natural molecule and bind to the receptor, activating it and causing a specific response. Antagonists. These drugs are like a key that fits into the lock but doesn't turn it. They block the natural molecule from binding to the receptor, preventing the usual response. For example, allergy medicines are often histamine receptor antagonists, blocking histamine from causing allergic reactions. Enzymes. Enzymes are proteins that speed up chemical reactions in the body. Drugs can act as inhibitors. They block or slow down an enzyme's activity. Statins, which lower cholesterol, work by inhibiting an enzyme the body needs to make cholesterol. Activators. They increase an enzyme's activity. Other mechanisms. Some drugs work through different mechanisms. For instance, antacids neutralize stomach acid directly through a chemical reaction, and some antibiotics kill bacteria by disrupting their cell walls. The desired effect of a medicine is called its therapeutic effect. But because drugs can sometimes bind to targets other than their intended ones, they can also cause off-target effects, which we know as side effects. The dosage is crucial because a higher dose can increase